This medication is used to treat tension headaches. It contains codeine, which is a pain reliever that acts on certain centers in the brain to provide pain relief. It also contains aspirin, which helps decrease the pain from the headache, and caffeine, which increases the effects of aspirin. Additionally, it contains butalbital, a sedative that helps decrease anxiety and cause sleepiness and relaxation. It is important to follow the recommended dosage and take this medication at the optimal time for best results. Before taking Ascomp with codeine, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually every 4 hours as needed. Do not take more than 6 capsules in a 24-hour period and use the smallest effective dose. It's best to take with a full glass of water, and do not lie down for at least 10 minutes after taking it. If you have nausea, you may take this medication with food. The dosage is based on your medical condition, age, and response to treatment. This medication works best if it is used as the first signs of a headache occur. Do not increase your dose or use this drug more often or for longer than prescribed. Suddenly stopping this medication may cause withdrawal, so it's important to properly stop the medication when directed. This medication may sometimes cause addiction, so take it exactly as prescribed to lower the risk of addiction. Tell your doctor if you notice any changes in your condition while taking this medication. Side effects of Ascomp with codeine may include nausea, vomiting, stomach upset, constipation, dizziness, drowsiness, and trouble sleeping. To prevent constipation, it is advised to eat dietary fiber, drink enough water, and exercise. It is also important to get up slowly when rising from a sitting or lying position to lower the risk of dizziness and lightheadedness. Additionally, if you experience any serious side effects such as mental/mood changes, fast/irregular heartbeat, dark urine, or signs of kidney problems, it is important to contact your doctor right away. In some people, codeine is changed into a strong opioid drug in the body, which can increase the risk of serious side effects such as slow/shallow breathing and severe drowsiness. If you experience any of these symptoms, it is important to seek medical help immediately. While very serious allergic reactions to this drug are rare, it is important to seek medical help right away if you notice symptoms such as fever, rash, severe dizziness, or trouble breathing. If you notice any other effects not listed, it is important to contact your doctor or pharmacist. Codeine, a component of Ascomp with codeine, carries a risk for abuse and addiction, and may cause severe, possibly fatal, breathing problems. To lower your risk, your doctor should prescribe the smallest effective dose for the shortest possible time. It's important to be aware of the signs of opioid overdose and have naloxone available to treat it. The risk for severe breathing problems is higher when starting this medication, after a dose increase, or if the wrong dose/strength is taken. Combining this medication with alcohol or other drugs that cause drowsiness or breathing problems can lead to serious side effects, including death. Additionally, other medications can affect how codeine works in the body. It's important to know how to take this medication and which drugs to avoid while taking it. If any serious side effects occur, such as slow/shallow breathing, unusual lightheadedness, severe drowsiness/dizziness, or difficulty waking up, seek medical help right away. Keep this medication in a safe place to prevent theft, misuse, or abuse. If someone accidentally swallows this medication, seek medical help immediately. It's important to note that children younger than 18 years should not use products containing codeine, as they may be more sensitive to its effects and experience serious breathing problems. It's best to discuss the risks and benefits of this medication with a doctor or pharmacist. Before taking Ascomp with codeine, it's important to inform your doctor or pharmacist if you are allergic to aspirin, caffeine, codeine, or butalbital, or to other medications like NSAIDs, opioid pain medications, or xanthine derivatives. It's also important to discuss your medical history with your doctor, especially if you have conditions like asthma, brain disorders, breathing problems, bleeding disorders, heart disease, gout, liver or kidney disease, mental/mood disorders, and other conditions. If you are planning to have surgery or medical procedures, let your doctor know that you are using this medication. Ascomp with codeine may cause dizziness or drowsiness, so it's important to avoid alcohol and marijuana while taking this medication. It may also cause stomach bleeding, so it's important to avoid daily use of alcohol and tobacco. Children and teenagers under 18 years old should not take aspirin if they have certain illnesses, and older adults may be more sensitive to the side effects of this drug. Women who are pregnant or planning to become pregnant should discuss the benefits and risks with their doctor. This medication is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. Breastfeeding is also not recommended while using this drug. It's important to be aware of potential drug interactions with Ascomp with codeine, as they can change how the medication works and increase the risk of serious side effects. Some products that may interact with this medication include certain antibiotics, drugs used to treat gout, lithium, methotrexate, and other medications for pain. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist before starting, stopping, or changing the dosage of any medicines. Additionally, this medication may increase the risk of bleeding when taken with other drugs that also may cause bleeding, such as antiplatelet drugs and blood thinners. It can also speed up the removal of other drugs from your body, affecting how they work. This includes drugs like doxycycline, estrogen, and certain beta blockers. Furthermore, taking Ascomp with codeine with other products that may cause drowsiness or breathing problems, such as opioid pain or cough relievers, alcohol, or muscle relaxants, can increase the risk of serious side effects. It's important to check the labels on all your medicines and ask your pharmacist about using those products safely. Finally, this medication may interfere with certain medical/lab tests, possibly causing false test results. It's important to inform lab personnel and all your doctors that you use Ascomp with codeine before undergoing any tests. If someone has taken too much Ascomp with codeine and is experiencing severe symptoms like passing out or difficulty breathing, naloxone should be administered if available, and 911 should be called immediately. If the person is awake and not showing symptoms, a poison control center should be contacted right away. U.S. residents can call their local poison control center at 1-800-222-1222, and Canadian residents can call a provincial poison control center. Symptoms of an overdose can include persistent nausea and vomiting, extreme drowsiness, slow or shallow breathing, very small pupils, severe dizziness, ringing in the ears, or coma. Sharing Ascomp with codeine is illegal and should not be done. For tension headaches, you can try relaxation methods like massage and hot baths. It's best to talk to your doctor or pharmacist for more information. While taking Ascomp with codeine, you may need to have lab or medical tests to check your liver and kidney function. Make sure to attend all your medical and lab appointments and speak with your doctor for more details. Ascomp with codeine is used to relieve mild to moderately severe pain. It is also used, usually in combination with other medications, to reduce coughing. It works by dulling the pain perception center in the brain. This medication is a combination of a salicylate and a narcotic cough suppressant. It helps to increase the benefits of aspirin and reduce the side effects of the narcotic. This medication should be taken by mouth. It is usually taken every 4 hours as needed. Follow the directions on your prescription label carefully, and ask your doctor or pharmacist to explain any part you do not understand. Take Ascomp with codeine exactly as directed. Do not take more or less of it or take it more often than prescribed by your doctor. When storing Ascomp with codeine, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to disposing of this medication, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.